Good morning. My name is Wendy. I'm going to be your nurse for today, okay? I'm here to perform a head-to-toe assessment. I want to make sure that everything is okay. Do you have any questions?
No.
Okay, I'm going to go ahead and check your armband. Can you tell me your full name and your date of birth?
Daniel Suarez, December 3rd, 1990.
Okay. You want to check the patient, make sure that what the patient tells you matches the armband. You want to make sure that you have the right patient, okay? This is important. Everything that you do, you always want to check that. Okay, then you're going to go ahead and move on to your head-to-toe assessment. You're going to start on the head. You're going to palpate the head and the scalp. You're going to palpate the temporal arteries and the mandibular joint, okay? Okay, Daniela, I'm palpating your scalp, okay? I want to make sure that everything is alright. Let me know if something doesn't feel right, okay? Okay. Okay. Can you open your mouth and close? Okay, perfect. Now we're going to go ahead and check some cranial nerves, okay? Can you clench your teeth? Okay, can you smile? Okay. Can you puff your cheeks? Okay. Can you close your eyes tightly? Okay, can you wrinkle your forehead? Okay. That's perfect, okay? We're gonna go ahead and now check your vision. And okay, see, I have a little card here. Okay, here, take it to the right eye, cover your right eye. Okay, and let me know, okay, when you see my finger, move into your vision, your field of vision, okay?
I see it.
Perfect. Now the opposite. Okay? For this test, you're gonna get on the patient's eye level. Okay?
I see it.
Okay, perfect. One more test. Can you follow my finger without moving your head? Okay. Okay. Okay, that's perfect, okay? I'm gonna check your pupils, okay? Is that okay with you?
Yes.
Okay, for this part, you're gonna dim the lights to make it better, okay, for the patient. Okay, I'm gonna dim the lights, okay? Just look at me. There, you're gonna see a light shining into you, okay? Just look at me. Okay, Daniela, that's good. I'm gonna check your ear and then your nose, okay? You're gonna check the ear. You're gonna use a pen light to get a better look. Okay, you want to make sure that it's clean, that there's no drainage or anything like that. Okay. You're also gonna inspect the back of the ear. You're gonna check for any skin breakdown or anything like that. Okay. You're gonna do the same thing to the other ear. You're also checking for symmetry and to make sure that you find the same thing that you found on the right, you find it on the left. Then you're gonna check the nose, the nostrils. And let me see your nostrils. You can also use your pen light, but make sure you don't shine it at the patient's eyes. Okay, let's now check to see. Okay, take a deep breath. Okay, any trouble? Okay. Okay, you want to make sure that the patient can breathe from both nostrils without any trouble, that there's no obstruction or anything like that. Okay, that you're also checking for nasal patency. Okay, you're gonna inspect also the lips, the oral mucosa, and the teeth. You want to make sure by inspecting the oral mucosa, you make sure that the patient is not dehydrated and that it's pink and moist, which how it should be. Okay. Okay. And let me see your mouth. Okay. Let me see your teeth. Okay. 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 Perfect. Can you open your mouth? At this point, you're going to ask the patient to open her mouth. You're going to use a tongue blade, or you can use your hands if you have gloves to inspect the mouth, okay? So I'm going to pretend this is a tongue blade. Open the mouth. Okay. You're gonna check the pharynx and that everything in the mouth looks okay. Say ah. Okay, you're checking for the elevation of the uvula and that everything it's okay. Okay. Also, you're also checking the tongue to make sure that it's clean, that it doesn't have any anything. Okay. Also, can you stick out your tongue? Okay. Can you move it? Can you put your tongue against your cheek? Okay. The other side. Okay, that's perfect. Now you're gonna go ahead and palpate the thyroid. You're looking for nodules, and you want to make sure the thyroid is in place. Okay. Okay, let's turn around. Okay, you're going to stand behind the patient and you're going to find the thyroid, okay? Okay. Here, you're going to hold it, move it, and then you're going to palpate. You want to make sure you don't feel anything. Then you're going to do the same thing to the other side. Find it, hold it to the side, and push it to the side, and then just palpate. Okay, Daniela, so far so good. Okay. And we're going to palpate your carotid artery, okay? You don't never want to do it both at the same time. Tell me if you feel anything, okay? Tell me if you get dizzy or anything. Okay. You want to do it on both sides. You want to make sure that it is even and you can feel them both, okay? Now we're going to go ahead and I'm going to listen to it with my stethoscope, okay? I'm going to use the bell of the stethoscope, okay? It might feel a little bit cold, okay? But first let me clean it. Okay, it's clean. It might feel a little bit cold, so don't worry. Okay. You want to use the bell of the stethoscope because it's good to hear lower pitch sounds. Okay, now we're going to go ahead and examine your heart, okay? Have you had any heart problems or anything before?
No.
No. Okay, that's good. You can go ahead and at this point, if you want to ask about family history of any heart diseases, you can even go ahead and include diet and everything like that. Okay? We're going to auscultate your heart, okay? This is the aortic, the pulmonic, this is Erb's point, the mitral, and the tricuspid. Okay. Also, you're gonna check for the arteries, okay? The radial, the tibialis, and the dorsalis, okay? You're gonna use both of your hands, okay? You're looking for symmetry. You're looking that they both sound the same, okay? Okay, this one is behind your knees. Okay. And the last ones are in your feet. Okay. Also, so you can, when you hear the hard sounds, you're gonna use first your diaphragm, and then you're gonna use your bell. The diaphragm, you're gonna use it for S1 and S2 because that's best for higher pitch sounds, and then the bell you're gonna use it to hear S3 and S4. As S2, S1 you can hear best at the apex of the heart, and then S2 you can hear at the aortic or pulmonic arteries. First you're gonna use the diaphragm, and then you're gonna use the bell. Okay. Now you're going to repeat the same thing but using this part right here. By using the bell you can hear any murmurs or anything like that. It will help you out for that. Now we're going to go ahead and move to the lungs, the posterior. Okay. You're going to auscultate. First you're going to percuss. Okay. You want to see how it feels. Okay. Always what you do to one side, you got to do it to the next. Okay. Say 99, 99.
99, 99.
Okay.
99, 99.
Okay.
99, 99.
Okay. That's good. Okay, we're gonna listen. I'm gonna listen now to your lungs. Okay. You're gonna do it posteriorly and then anteriorly. Take a deep breath with your mouth open. Another one. Another one. Take a deep breath. Another one. Another one. Okay, that's good. Now you're going to do the same thing at the front, okay? Take a deep breath. A deep breath with your mouth open. Through your mouth. Okay. 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 You can go back and sit. The next part is inspecting the abdomen. For that, you're gonna have the patient lying down. Okay. Okay. Here. Okay. You're gonna uncover the abdomen. You first want to look. Make sure inspect the abdomen. See how it looks. If you have symmetry. If it's bulging. If there's no symmetry. Anything that's visual you want to do. Then you're going to go ahead and you're going to palpate. You're going to listen and then you're going to palpate, okay? When listening to bowel sounds, you want to spend 5 minutes in each quadrant, okay? You want to make sure before you say that there is no sound, okay? I'm going to listen to your bowels, okay? Okay. want to then palpate, make sure there's not any masses or anything like that. See if the patient is in pain. You also might want to ask them if they're in pain, see how it feels. Okay. You're also going to check the liver. You're going to check the liver and the spleen. You want to make sure they are in where they're supposed to be, that there's no enlargement or anything like that. Okay? Your liver. Okay. Spleen. Okay. You're also going to listen to the aortic. You're also going to listen to the aortic, the renal, the iliac, and the femoral artery. Okay. The aortic. Okay. The renal. You're going to listen to it in both sides. The iliac. And the femoral is going to be down. Okay, Daniela. So far, so good. Everything looks like it should be. Okay. Now I'm gonna let me percuss. Okay. Let me feel your kidneys. Okay. Spleen. Okay. Now you want to do deep palpation. Okay. Now this might feel a little bit uncomfortable, okay? You tell me if you're in pain, okay? Now you're gonna have the patient sit. The patient's gonna sit up. Okay. And we're gonna do a neural check, okay? I want you to. I'm gonna put my hand in your face, and I want you to rotate your head and push against my hand, okay? Rotate. Rotate. Rotate like that. Okay, right. Okay. Now I'm going to do it in your shoulders and you're going to shrug against my hands, okay? Okay, that's good. Now get your palms of your hands and I want you to do like that. Do it as fast as you can. Okay. Okay, that's good. That's good. Okay. Do finger to finger like this. And then do it again how you see on your way back. You do it one way and then on the way back. Okay, that's good. Okay, can you lay down again? Okay, you're gonna put your heel, your opposite heel to the knee. To the knee, your heel to the knee. Okay, and then move it all the way to your toe, your heel. Okay, now with the other one. Okay, that's good. You can sit down again. Now we're going to test the reflexes, and with a hammer, the nurse will click on here on the knee, and the reflexes for the leg to raise up after hitting the knee, okay? Okay, can you stand up? Can you walk to that point over there? Straight. Okay, can you walk back? Okay, can you walk on your toes? Heel and toe, heel and toe. Okay. can sit down. Thank you. You wash your hands at the end of the examination. You thank the patient. And this completes our examination, okay? Thank you very much.
Luego padre y decía hace rato, pero ahora no me da.
No importa.